Hi, everyone, and welcome to our AOPA Advocacy and Action webinar. Now we'll turn it over to Eve Lee, AOPA's Executive Director.
Hi, everyone. I'm Eve Lee. Welcome to the webinar. Thanks for joining us today. With me, I have Tracy Drawley, AOPA President for this year, and I also have AOPA's Director of Health Policy and Strategic Alliances, Ashley White. We're excited you all are here, and we want to have a brief conversation about our piece of legislation that we've been talking about for months and months now, and our grassroots advocacy efforts that have been underway, well underway throughout the summer. So Ashley, I'd like to start with you. If you could just give us a brief overview of the bill for those that might not have heard about it.
That's a perfect place to start. So we have a piece of legislation called the Medicare Orthotic and Prosthetic Patient-Centered Care Act. So you may have seen that we had made a big announcement about HR 1990, which is the bill's introduction in the House. That's the bill number. And the bill has 4 substantive provisions that focus on O&P patient care and prevention of fraud and abuse. So the provisions are a distinguishing, administrative distinguishing, distinguishing between O&P suppliers, so orthotists and prosthetists, from suppliers of traditional durable medical equipment. And this really comes down to the fact that there is a care protocol, a continuum of care that our patients, that O&P patients need to have, if that's part of the Medicare benefit. And so it's protecting that provision of care. And we really believe that distinguishing O&P from DME is the way to do that. The next provision is a restoration of Congress's intended definition of an off-the-shelf orthoses when they decided to create the competitive bidding program. Congress said, well, of course, orthoses could be part of that as long as the brace could be put on the patient by themselves with minimal self-adjustment. And we focused on that term minimal self-adjustment in the language that we use for this provision, because when CMS regulated the competitive bidding program, they expanded that definition to include caregivers and suppliers. And where we're really concerned about that is in that expansion to the supplier, because an off-the-shelf orthoses is not supposed to have any clinical component to it at all. It should be something that someone can receive, go into a CVS and pick up. It really should be a durable medical good, as opposed to a brace that needs clinical intervention, which is not to say that your clinical intervention for fitting an off-the-shelf orthoses is not valuable, but there is a place for this distinction in types of devices. And so what we've asked is that Congress recognize their own intention when they defined what could be competitively bid and restore that definition to be something that the patient could fit on themselves alone. And we're certainly not talking about whether or not a individual, a Medicare beneficiary who has a child that might be helping them, fit their brace or tighten a strap. That's not what we're talking about. We're talking about the actual delivery of these devices, the actual provision of off-the-shelf orthoses. The next provision is a drop shipping prohibition on anything that is custom fitted or custom fabricated. So using the definition that we just described of what an off-the-shelf orthoses is, this would be prohibiting the drop shipment, which is a very specific term. It means direct from the manufacturer to the patient without clinical intervention. And it would be a prohibition of that practice for anything that is not truly off the shelf. And we also specify in the language, in the bill language, what we mean when we define that category of devices. So it is those devices that are truly off the shelf, those that can be put on the patient by themselves with minimal self-adjustment. And the final provision is an exemption for orthotists and prosthetists to be able to provide these off-the-shelf orthoses in clinic, especially when they're seeing other patients. Of course, it makes a difference when you have an individual in your office and you're providing a custom brace or a prosthesis, and they need something off the shelf as part of their treatment protocol, and you want to be able to provide that to your patient. And OTs and PTs and physicians right now, they have this exemption. And so what we're asking is to be treated like PTs and OTs and be provided that same ability to get our patients what they need, instead of having to send them to another place, a supply store to be able to pick up those off-the-shelf orthoses. So that's the 4 provisions of the bill. And yeah, I mean, I think it's being really well received on the Hill. We've had some really great meetings. So.
That's great.
Yeah.
Well, and I really appreciate especially how you went through each provision and how it will change practice. So rather than just saying, here's the provision, you actually went into an explanation of this is how practice will change and improve and how the patient experience will improve. So thank you for that. So we know that the bill was introduced in the House earlier this year in HR 1990. Can you give me the update on where we stand in the Senate?
This is actually really fun. Okay, so literally as we were sitting down to turn on the video camera for this webinar, I got a text message from one of our lobbyists at Austin and Bird, and she said, hey, we've got ledge council language. So why that matters is because if you have ledge council language, that means that we're ready, you know, we're really, really close to being able to take the bill to the floor for introduction. So we are so close. Now I haven't reviewed the ledge council, the language from ledge council, but fingers crossed that this is going to be identical to the language that was introduced in the House. That's what we've been telling all of our sponsors, especially the leads. You know, they want to make sure they're not signing on to something that they haven't approved. So we're expecting it to be identical to the language in the House. And you know, we really tried to be careful this time around to make sure we hear all the stakeholders' concerns, and we're continuing to be open to working through any concerns that other stakeholders might have. So it's just really exciting. I mean, you know, to really be able to say, okay, we're very close. And I know if you've been part of this process long enough that you all are probably at home saying, okay, well, you were saying it was going to be introduced last month. This is a wild ride up here, and a lot has to happen a lot has to go exactly the right way. You have to have all the right people in the right room at the right moment in order to get a bill introduced, and much more to get a bill passed. And so we've been working really hard, and we're excited to be able to announce that we're very close.
Definitely. And I love that last minute up to the very minute of that. So I know you've been on a lot of visits since the policy forum, just kind of blanketing the House and the Senate to really talk about this bill. Can you tell me a little bit about how those meetings have been going?
Yeah, I can certainly dig into some of the different offices that we've met with, but even more importantly, I think it's great that we have Tracy Drawley here with us. She has been in town, and we've been in 5 meetings just in the past day. So we were on the Hill in person yesterday. It was a really beautiful opportunity. It's a little eerie on the Hill right now. There's still a lot of security to get into the building, and but we were able to have some in-person meetings yesterday, and we had another Zoom meeting this morning. So like I said, 5 in the past 24 hours. So we're really digging in on those meetings. Tracy, do you want to talk about your experience and you know, just this week in general?
Yeah, it's been a whirlwind. I landed yesterday morning at 9:30, and it's been terrific, honestly. All of the visits yesterday were so well received by all of the senators that we met with. Philadelphia has businesses in lots of different states, and so we were able to meet with representatives from each of those states. And it was, you know, it's so important that the constituent is there. So we had Ashley and Eve representing AOPA. I also represented AOPA in that meeting, but they were very interested in having the constituent there. In fact, when I was in Senator Haggerty's office, you know, his person there, she kind of honed in on me and said, you know, if our constituents wants this, we want to hear, we want to know. And so it's so important that we as AOPA members, we as the O&P profession are reaching out and being supportive. And I would encourage anyone, if you're going to be in DC, the Northern Virginia area, even Baltimore, or thinking about it, you know, I would encourage you to come and you know, contact AOPA and be a part of this, because it was a really tremendous opportunity. I was even able to have dinner last night with Senator Daines, who is going to be one of the original sponsors of this bill. And that was just a fantastic opportunity to be able to thank him for his support of the orthotic and prosthetic profession. He was so pleased that Eve and I were there and able to, and he is very, very supportive and committed to getting this bill through. And then even this morning, I was meeting with Chris from Senator Blackburn's office, and he was like, I told him I'm from Chattanooga, and he said, oh my gosh, love Chattanooga. I'm from Nashville. We're going to be home for August recess. I'd love to see your facility if you're accepting visitors. And I, immediately said, please, we'll set up something. So even at the end of the conversation, he reiterated his interest. And so we're going to make a time for him to come and visit our facility. So, I know we're open, and I don't know kind of, what's going on in your areas, but I'd also encourage you, as August recess is coming, and if there is a possibility that you have time for them to come in, even if it's, blocking off maybe, earlier in the morning or even later in the evening, if you're last seeing patients at 4 or 5 and you'd be willing to have them come over at, 5:30, I really encourage you to invite the members and or their staff to come and really learn what orthotics and prosthetics, is and what this profession is all about. Because as soon as they hear about it, they get excited. What we do and what each of you do, for patients and for Medicare beneficiaries, but just, patients in general is really remarkable. And so it's a great opportunity to showcase really what we are and why this bill is so important to get across the finish line in 2021.
So to that point, Tracy, you don't meet with senators and representatives and their staff on a daily basis. It's not your day job.
No.
But when we were there, can we kind of talk through, because it might sound kind of intimidating to somebody that's never done it. Can you talk through how the meeting flowed and the support that you had, or what your role specifically was, and then where you had support from others in the meeting?
Yes, great question.
So that people feel more comfortable and it's a little bit more approachable, because you don't do this every day.
No.
And I don't do this every day. So can you talk a little bit about that?
Sure, yeah, I will say that the support is great. So my role as a constituent and was really, I'm there as a constituent. So I talked specifically about my company, Phil Hour, where we're located, our team and what we do, and how their support is important. And then we had Ashley, and sorry
about that.
We weren't moving enough, obviously, although I think we all talk with our hands, so I'm not really sure how that's possible. But anyway,
it's really fun.
So so welcome to, motion detecting lights in a meeting space. This is a first. We're gonna have to remember that tomorrow. But back to what I was saying. So for you, for me, and for anyone that comes up here, your role really is to just speak specifically about who you are, your company, how long you've been in business there, what it is that you do, and really speak from your constituent. And then we have Ashley, really, who is, I can't say enough great things about the support she provides. So what she just went over with talking about the bill and all the specifics, that's her role. So you do not have to think, oh my gosh, I've got to know this bill backwards and forwards. They're going to ask me questions I can't answer. That's why she's here, and that's what she does. And so it's kind of like you're like the guest in a lot of ways. And then she gets
You're the star of the show.
Well, okay.
You are the star of the show.
Okay, yeah. You get to be the star of the show.
That's right.
And then they get to come in, and Ashley gets to come in and explain all of the details, answer their questions about Social Security regulations from 20 years ago that you and I are probably not going to know a lot about. But she's your expert, and she's there with you along the way. We also have our great lobbying firm that is supporting us as well, Austin & Bird. And so we have that team that also participates in all of these meetings with us as well. So it's terrific. So you really just get to come in, brag about your business, your company, what you do, and then let them kind of take the rest away. So yeah, great question.
That's great. That's great.
Yeah, so I think that just speaks to a reality that we want to make sure you all at home hear us saying, which is if you're going to be in the Washington area or you want to come up and meet with your senators, I think that
or if you would like some help with in-district visits.
Absolutely, yeah.
We're happy to help coordinate in-district visits also.
Absolutely.
And offer the same type of support.
Yeah, I think we want you all to know that this isn't something that's happening behind the scenes, that's being done for you, but without you, it really does take everyone to get involved. And just the fact that we were able to secure these meetings so quickly with Tracy in town, I think that shows how important it is to have that constituent voice be part of the conversation. And so I know that it helps me when I have to follow up and I can reference a constituent. It matters. And so thank you so much, Tracy, for being here, these past couple of days, and for being engaged in these meetings.
Thank you both so much. Thank you just for setting this up. It really was great. So thank you. A lot of fun yesterday.
Yeah. So Joy, do we have any questions from the audience?
Just one question in terms of, if there can't be in DC or don't have access to bring someone into their facility, how would you best recommend getting involved and reaching out to their representative or senator?
It's a great question. So I think there's a couple of ways that certainly AOPA can support you and your outreach. If you're interested in having calls with your members of Congress, let's shoot us an email and let's figure out what that timing looks like, what your interests are. If it is just to support the bill, there are a few steps that we can help walk you through in addition to requesting a meeting on your behalf. And we can do those meetings via conference line or Zoom right now, so you don't have to come to Washington. We were just pointing out the fact that when you do, it might be even easier to get those meetings because and we get to be the exclamation point in a lot of these cases because we're the only ones in the building. It is amazing how many offices said, yeah, you're one of our first meetings back in real life. And so I think that's making an impact also. But that doesn't mean that Zoom option or that conference line option isn't still there. And I'm happy to help set those meetings up. And we have, like Tracy said, we have support from our lobbying firm that can also help organize those meetings. So whether you want to reach out just basically with your support, we have a sign-on campaign right now just for the House bill, but certainly soon we'll be pushing out a big announcement about writing your senators as well. And that will just signify sort of your support of the bill. And that's the very basic step that you can take. If you've already done that, then it's probably time for us to talk about other ways that you can get in touch with them, including requesting a meeting like what we've been doing this week. Any other questions?
No, but just a reminder to folks, you can submit your questions and I will pose them to Ashley, Eve, and Tracy. But I guess a question just for me, or just because I know where the information is, but they might not. Where on our website can people find information about the bill and how to send a message to their representative or senator?
Great question. So if you're on aopanet.org, so that's just AOPA's homepage, you'll see our legislative, there's a tab. There's our content navigation at the top, and there's a tab for our legislative work. And if you click on that link, it will take you to an overview, kind of like what I provided, of the provisions of the bill, as well as the links to AOPA votes to get involved. Now, if you haven't written your member of Congress in the House yet, to ask them for their support for HR 1990, you should go to aopavotes.org. aopavotes.org is where you will find that sign-on campaign. And it is so easy. You literally just put your name and your address in, and it does all the work for you. And you can customize it and add in your own story if you want to before you send it along to the office to your members of Congress. So,
and Ashley, do those letters really matter?
It's an interesting question. Yes, I think that they matter, especially in numbers. So when we go to an office and they say, oh yeah, we've heard about this, 9 times out of 10 they've heard about it because someone, one of our members has written a letter. It's not always because the person that we're meeting with, the staff person that we're meeting with, actually met with a constituent. They tally those letters. So we're not the only organization that has one of these campaign software systems. So it's very common for them to receive these kinds of form letters. But if you start to get up in the 200, 300, plus numbers, it matters. It makes a difference because that means that there are enough people in their districts or in the state that to signal some importance for the issue itself. people don't go through that process if they don't actually believe in the message. Any other questions?
No, I am not seeing any, but would like to say that this is being recorded and we will send this out. I think this has been really helpful, even if people weren't able to attend, just to send around to their colleagues for a quick listener watch.
Yeah, that'd be great. I think we want to expand these. We're going to continue to do these sort of in this style, and we'll have some guest speakers. And our idea about the way we want this to be accessible to our members, as opposed to, again, that thing that's happening in the background in Washington that nobody knows about. It's not like that at all. It's very important work, and you all are an important part of it.
Yeah. And I will say, if you do happen to want to come to DC, now's the time, because there's no traffic.
Yep.
There's not a lot of people around, so it would be a great time to come and visit.
I'm not going to promise great weather, but we will promise it will be a manageable trip. It will be a manageable trip.
Yeah.
And if you happen to be interested in reaching out to any of the members that we just recently met with, those offices are Bennett, Tillis, Haggerty, Burr, Blackburn, and Danes that we've met with. So if any of those are your senators, please take the opportunity to reach out and just let them know that you're part of this O&P profession and that you are supportive of the Medicare O&P Patient-Centered Care Act.
Yeah. Thank you both so much for being on today. We really appreciate it.
All right, great.
Great. Thank you, everyone.
Bye.
Take care.